more. Perez, anything you want to mention here, sir, before we get to our next guest?
No, I want to sneeze, and then we'll move on.
We'll do both of those things at the same time. Dr. Brittany Hines is a Mississippi asthma and allergy specialist. You got to be in high demand right now.
Yeah, I think that all of us in the clinic are busy.
I don't even know where to start. Is this year worse, by the way, Dr. Hines, than normally? And then stop coughing over there. Use your cough button. So, is it more so?
I think that with each allergy season, we almost see it starting earlier and more intense. So, we definitely have lots of patients come in, especially this year, that I think would say that this is a particularly bad pollen season.
Is it worse on kids or adults, or is it really doesn't matter?
I think we all here at the clinic see people from very young, to the elderly patients. And the thing with allergy is that it can affect you early in life, or it can kind of come on later in life. So we really see people from all ages affected by it.
Let me use your expertise on this one. If you have a newborn or a young toddler or someone who's not too far from, going to kindergarten, how do you address this? How do you know if they are subjected to allergies? And we're living in Mississippi, and we know a lot of people do. And what do you suggest they do to prepare for this, or how to attack this?
Sure. So, kids with allergy, they, tend to have those symptoms that adults have, or anyone, runny nose, coughing, sneezing, nasal stuffiness or nasal congestion. We see those patients usually around age 2 to 3 start to form their outdoor allergies. And we do test patients, down to that age to try to assess whether their symptoms are being driven by allergy or other issues such as structural problems in the nose. As far as how to address those things, there are definitely over-the-counter medications. It depends on the age of the patient, as to whether or not parents will be able to pick something up off the shelf at the pharmacy and that be dosed down to their age, or whether or not it probably is better for them to get the advice from a provider, whether that be their pediatrician or be referred to an allergist for, further recommendations regarding dosing for the allergy medications.
I guess there's a line here too where the symptoms are so severe they really bring down the health of that child. But the same thing could be said for an adult, could it not? When they're so severe.
Yeah, and we see especially in kids and adults that patients with allergy, they have this kind of underlying inflammation that's present, which makes them more susceptible to also getting sick. And so a lot of kids with allergy tend to not only have the allergy component of it, but they also tend to be patients who get sick more often. And if they have a predisposition for asthma, then they also will have those things flare up when the allergies are at their peak, which is for a lot of patients this time of year.
Is there any research that you guys have seen in your career that says a diet can be changed to maybe be more proactive on this, and diets matter in this as far as allergies are concerned?
Yeah, I'm not familiar with any one particular diet that I can tell you to go to try to prevent the development of allergy or, to take away allergy once you have it. But I would say that just in general, a healthy person is going to be able to,
absolutely,
handle, these things a little bit better. So I'm not able to tell you, though, like a specific diet or other things. There are some things maybe out there, but I don't know that they're really validated in good research.
Yeah, when you start looking at the testing of a young child, how soon should they be tested? And by the way, have the test, and I'm going back to parents' days and also some of the older grandkids of when they were tested. I think it was the scratch method. Is that still the way it's done?
Yeah, it is. We still use, we call it skin prick testing or scratch testing.
Yeah, that's it.
Yep, that's the one.
Yeah, you haven't modernized that at all,
huh? Still sticking with tried and true, I guess.
Gotcha.
Yes, we still use that method. There are two methods to do allergy testing, and depending on the situation, we will choose one or the other. You can do the scratch testing. It is possible to test allergies by drawing blood, but most of us prefer to do the scratch testing in the clinic. to answer your question about, how early to test patients for allergy, it really depends on the situation. With food allergy, we'll test them very young. If you're talking about environmental allergy, it really depends on the situation and a discussion with the parents. Like I said, most of the time, less than age 2, even if they're forming allergy, it may be hard to pick it up just yet. It's just still very early on, but we will have those discussions with parents and consider it.
If a child gets the vaccines on the daily allergy shots or the weekly allergy shots, and they stop those over a period of time, would that mean the allergies are coming back, or do they have to keep these up the rest of their lives?
Sure. So in some patients, we do the allergy shots, also called allergy vaccines, as some people refer to them, and they are weekly injections. Typically, patients get those weekly for around, it depends on the schedule that they use and how they tolerate the shots, but somewhere around 9 to 12 months. At that point, we do try to start spacing out the injections. We try to get and see if patients can tolerate it once a month. The typical duration of allergy shots is about 3 to 5 years. And after that time period, we usually have a discussion with the patient about whether or not they want to trial off of the shots. The purpose of the allergy shots are to, change the way the immune system encounters the environment and to try to make them more tolerant to these things floating around in the air. And the whole purpose of doing it is really to try to induce sustained tolerance to the environment. And so if someone's completed a 3 to 5 year course of allergy shots and have gotten benefit, it's very likely that person will go on to maintain that benefit that they've gained from it after that.
Well, that's good news. As far as never having any allergy shots, and you're an old codger like some people we know around here, is it just too late to start taking? Start taking. I mean, come on. Is it even worth the expense to take allergy shots if, let's just say, you've got your AARP card?
What are you trying to say?
You know exactly what I'm saying.
I don't take allergy shots anymore.
I didn't say you specifically.
Oh.
No, go ahead.
I don't think that there is an age limit that any of us put on the allergy shots. And I think for each patient, it's different why they're doing it. If you're fairly miserable from the allergy, I think that it is worth your time and expense to do the allergy shots, because sometimes those are the main thing that help people to manage their symptoms. The main thing that we also take into consideration are patients' other medical issues as to whether or not, the risk of the allergy shots would be worth the benefit that they might gain from being on them.
Any new technology out there, or any a new nose spray that's over the counter that you guys recommend as far as over the counter?
She's not going to offer you anything.
Well, I'm just trying here. Just stick with me.
A lot. I would say, there's a lot of really great allergy medicines available over the counter. I think where patients have a hard time is picking out which one to pick up and how to use them and in what combination. I do recommend for many patients, which is available over the counter, intranasal steroids. Those are things like Flonase, Nasacort, Nasonex. Yeah. And sometimes in combination with the antihistamines that are non-sedating, like Zyrtec, Claritin, Allegra. And those can be very good options for patients. I think one thing I'd like to add is a lot of these allergy medications work best when used more consistently rather than here and there.
Yeah, I got a couple of other questions. Somebody wants to ask about ear infections and earaches. Is that part of it?
Sure.
And a couple of other questions. Can you hang on for a second?
Sure, yeah.
Dr. Brittany Hines, Mississippi Asthma and Allergy Clinic. We'll have a couple more questions. If you've got something, shoot it to us quickly at 601-879-4395. Back with more next. Medicines with you, Dr. Brittany Hines, Mississippi Asthma and Allergy Clinic Specialist. Question number 1, earaches. Is that a symptom of possibly allergy too?
Yes, it can be, and we get that complaint a lot from our patients. A lot of the times when patients have a lot of inflammation in the nose, there's a little tube that runs from your ear to your nose called your eustachian tube, does not function properly, which can lead to earaches, fullness in the ears, and some people describe popping in the ears or difficulty equalizing pressure. So certainly that could be a symptom.
Yeah, question number 2, does honey from your area really work for allergies?
I get that question a lot. I don't know that there's great randomized trials that kind of give us an estimate of how much you need to eat or whether or not that's really helpful. A lot of people say that it's helpful, and for most patients, it's not necessarily a harmful thing to do. So I can't give great advice on how much or what to get, and I don't know how well it actually works from an efficacy standpoint. But for the most part, for most patients, it wouldn't be harmful necessarily to do that.
Hold on for this one now. I tried doing the sinus flush. I tried to do the sinus flush with a neti pot, and it would completely stop up the opposite nostrils with mucus. Do I need to continue to try to flush it out, or does that mean it's too bad for the flush to work?
There are definitely, it's hard to say, but, some patients do get extremely stopped up or stuffy in their nose to where it makes it hard for those flushes to come out the other side. There are some ways and some kind of techniques that we talk to patients about doing. Sometimes we try to decongest the patient with, certain medications to help them get onto these nasal flushes and control that inflammation. I definitely think saline rinses like the Neti pot or there's a NeilMed device are very good for patients, and they can help keep mucus moving and prevent, need for antibiotics and sinus infections. So definitely think it's a good technique and a thing to use, but sometimes we have to do other things on the front end to help patients be able to get on those things and use them properly.
The new one, the Navarre, the one that sucks, is it called the Navarre? I've got one in there, and I've used it for a while. What's your analysis of that one?
Is this like one of those electronic, like lavage?
Yeah, this is the one with the battery that just irrigates you all the way through.
I think the main thing is trying to get a high volume of saline in the nose and flush it out. So I think some of these devices just make it easier for patients, less messy for patients to do these things, which in turn allows them to be more compliant with doing the rinses and doing them. So I think that they're a great option for patients.
Can you mix your own solution as far as saline is concerned?
You can. The big thing, though, is following the right recipe, if you will, to make the salt content be proper.
You know what that is?
I do. I can tell you in just a second what that is.
Okay. Can you use, while you're looking it up, can I ask you, can you use popcorn salt?
Sure. I have never heard of using popcorn salt. I'm not going to say that wouldn't be something you can use.
I wouldn't suggest that.
Yes. Well, and the main thing, too, is using distilled water. You want to use clean water when you're doing these rinses. And so that's very important whenever you're doing it. So the recipe that I have for saline irrigation and the handout that I provide to my patients, if they want to make their own rinses, is using 1/4 of a teaspoon of kosher or pickling salt, 1/4 of a teaspoon of baking soda, and 8 ounces of warm distilled water. You want to make sure you don't use baking powder, and the salt needs to be iodine free if you decide to make your own mix. The easiest thing, although it may cost a little bit more to do it, is to actually use the little packets that come with the NeilMed or the Neti pot rinse bottles, or if you have one of these electronic devices, a lot of the times they'll have their own packets that you can buy. But, obviously getting a big thing of baking soda, a big thing of pickling salt, and getting your own water is probably easier, but you want to make sure you have the recipe right or it will burn when you go to use it.
You made a very good point, too, as far as it says what water should be used in the Neti pot, boiled or distilled, and I think you mentioned that. It needs to be distilled for the most part. You got to be careful those things are cleaned out and bacterial soap, and make sure they're clean, because you could cause more problems than you've solved if you get an infection from one of them that's contaminated. Final thoughts as far as to be proactive against the allergies this season.
Yeah, I think the big things are, for patients to get on top of this early rather than waiting until their symptoms are really, really bad. So like you mentioned, being proactive, starting medications early in the allergy season, because I feel like especially in the South, we get hit really hard, really fast with these pollens. And so if you're not on top of it, you can be pretty miserable pretty quick. But if people have questions or are not sure what to pick up over the counter, we're certainly happy to help them with
Yeah,
those
and if you can't
decisions
find
and try
anything-
to give them advice.
Very, very good advice. And I was just going to say, if you can't find it at the drugstore, stop by the liquor store. That's the
you go.
next option.
That'll help. That'll make it work.
Yeah.
Yeah, one way or the other.
Yep.
Doc, thank you so very much. I appreciate it. Very, very informative, and I look forward to having you back. Thank you, ma'am. Appreciate it. Dr. Brittany
Yeah,
Hines.
you're very welcome. Thanks for having me.
You've got it.